So as everybody just enters, I'm just sort of repeating some housekeeping rules. If you aren't one of the speakers, if you wouldn't mind switching your camera off and your speaker. Thank you so much. If you have any questions, you can use the chat function box just to the side as well during the session.
Great. Hello, Palia. Hello, everybody.
Hello, Jane.
Just checking my connections. I'm trying to close down every other window so that we don't have a problem. Okay. So, Palia, tell us when we should kick off.
Might just give it, we've nearly got everybody here, I would say, a good percentage of the people. So I might just say we'll kick off in maybe the next 2 minutes. I've got somebody calling me, so it won't be a moment. It could be somebody just trying to jump in. So give me a moment. Okay, have we got all of the speakers here? So Derek, Jane, Jide, Vanessa, are you available? Can I see your speaker and your screen on if you're here somewhere? And Robbie. Maureen, if you're here as well. And if you just say something through the speaker, it'll actually bring you up to the top of the screen for everybody. And then we can start changing.
Yeah, hello, this is Jide here. I am good and ready to go.
Great.
Hi, this is Vanessa.
Excellent.
Perfect.
Hi, hello, this is Robbie.
Perfect.
Hello, Robbie, that's great. Maureen, are you okay?
Hi everyone, I've just got Maureen on the phone. She's trying to join. I can see her initials up there, but Mo, you're not in from your end, I take it. You're not in. Okay, let me mute this and we'll talk through it. Palia,
Yeah.
Maureen can't get in. Could you just resend her the
Yes,
link?
the details.
Yeah.
Jane, if you and Derek would like to start, I'll quick.
Hang on, I'll just wait for Derek's just supporting Maureen to make sure she's all in one piece and connected.
Partly it might be worth telling Maureen that it could be in her junk files, because that's where my meeting link was.
Okay.
So, ladies and gentlemen, we are just getting our technology under control, and we'll be starting any minute now. So thank you for your patience. It's the COVID techno moment.
Derek, she should have the new link by email from me now. If Maureen could just. Perfect. So for anybody that's just joined, if you aren't speaking, if you wouldn't mind turning off your camera and making sure that you are on mute.
Finally.
Maureen?
Yes.
Have you?
Okay, thank you.
Well done, Maureen. Are you okay?
Yes, thank you.
This is a new approach. Rather than getting stuck in a tube train or a bus now, we get stuck on a Zoom, on a Teams link, so we understand. Okay, are we all, should we kick off and start? Yes. So first of all, my name's Jane Anderson, and I have the privilege of co-chairing the London Fast Track Cities Group. And this is our event for Black History Month, and we're absolutely delighted to be working in partnership with the One Voice network of Black organisations across the UK, which is we have Derek Brown, who is the CEO of One Voice Network, and G.D. Mccauley, who's the chair, amongst other things. So today the intention is to have a discussion across a number of particular points which we think are really important issues if London is to achieve its Fast Track Cities ambition of getting to zero, which is zero new infections, zero preventable deaths, zero HIV associated stigma, and the best quality of life for Londoners living with and affected by HIV. So it's a big ask, and there's a lot of work still to be done, and we know that Black communities have got a particular set of issues and complications that really mean we have to look long and hard at how we make sure that things are done as best as they possibly can be to make sure that together we can get to zero for Black people. And London has got the greatest diversity, and I have been privileged to work in the East End of London in Hackney for many years, working with many Black communities, and I have learnt so much from the time that I've spent in those communities and with those communities, and it is an absolute privilege to be here today. So I'm just going to hand over briefly to Derek to introduce the One Voice Network, then I'll introduce the panelists and we'll start the conversation. So Derek, over to you.
Thanks very much, Jane. Am I unmuted?
Yes, you are.
Oh, excellent. Good, good. It's a pleasure to be here. Thank you for that introduction, Jane. It's a pleasure to be here alongside yourself, speaking on behalf of Fast Track Cities. But it's important that we don't just talk to each other. Our audience is here, and they are the most important part of this conversation, and beyond them, the networks that they reach. So One Voice Network, I am the chair of One Voice Network and the CEO of AHP and African Health Policy Network. One Voice Network, we are an independent collective of Black-led community organisations and allies, and our aim is to improve the health and well-being of Black communities in the UK who are affected by HIV. So getting to zero, there's a obvious and magnificent symbiosis there. We're looking to end new HIV transmissions, and stop late diagnosis. But One Voice is also looking to empower and amplify Black voices and the voices of Black people living with HIV, and also to provide a mechanism for those voices to help shape the health and care services which are actually intended for them. So there's no better place for us all to be today than here discussing these issues, and it'll be very interesting to see where it takes us, but hopefully to greater symbiosis and greater networking and working together. Thanks.
Thank you very much, Derek. And this is very opportune because, of course, the whole business of the Fast Track Cities initiative is about partnership, networks, bringing everybody together, collaborating and convening. So to be working with you is really important. And I think we have a real opportunity here. So I'm very briefly going to ask the panelists to just very quickly go round and introduce themselves so that we know who's on the line, and then we'll start the discussion. We have Maureen, who is from AHPN. Do you just want to say a quick hello?
Hello, I'm Maureen from African Health Policy Network.
We've met Derek, Dr. Vanessa Appiah from BARTS.
Hi everyone, I'm Vanessa. Nice to see you all.
And we have Robbie Curry, who's a Sex and Reproductive Health Programme lead for the London Borough of Bexley.
Hi,
Robbie,
good evening, everyone. Hi, hello. Nice to see everyone.
Fantastic. And we have Reverend Father Jide Mccauley, who was on the screen a minute ago. Jide. Quick hello.
Right. Hello, everybody. Hello, everyone. I had to unmute myself before I speak. So, hi, everybody. I'm Jide Mccauley. I'm a priest in the Church of England, and I'm also the founder and CEO at House of Rainbow. And I also have the great privilege to be the vice chair for One Voice Network. So I'm looking forward to the conversation.
Fantastic. Thank you. So that's a quick introduction to our panelists who you'll get to know better as we go along. Please put any discussion points that you'd like to have in the chat, and Parley is keeping an eye on that for us. What we want to try and do is have a discussion, and if there are points that you want to bring up, we will try and make sure that we have some space to ensure that those points are considered in the discussion. But we were going to kick off really with actually picking up something that Derek said about services and what we actually need to be doing to ensure that services are right and are the best they can be for Black people across our city. So I was going to ask Maureen if she could start to reflect perhaps from her perspective what she might want us to think about as we start talking about how do we improve services. Maureen, over to you.
Jane. Thank you, everybody. Thank you for taking your time to come and sit on this forum so that we discuss the way forward. I'll just take this as an opportunity to reflect on what has been going on and what has happened in the past. And I've been living with HIV for the past 15 years right now. And I think we've done quite a lot of work in trying to empower.
Sorry, I might just stop you there. If everybody could just pop their speakers on mute, there's just a bit of background noise with your.
Yeah, I can see some some feedback as well. Yeah.
Thanks, Parley. Okay, on mute.
Thank you. I was saying, I mean, I've been living with HIV for the past 15 years, and quite a lot has been impacted in my life to be what I am today. I remember we started by, when we got the diagnosis, we were inferior, we were scared, we were all sorts, and we were just devastated by just the news that you are HIV positive. But now, with all the work that has been done in the previous years, we find that we have created ourselves a community of champions of African communities living with HIV who are strong enough and are free to express themselves and engage with service providers wherever in different areas. But then looking at where we are now, we've done quite a lot of work in investing in people's lives, and which is very, I applaud that kind of work, which every other service providers have done so far, and that has brought us to be where we are. We are independent and we can speak positively, and we are actually engaging. But then I'm looking at a different angle now from today, which is something that I thought we should look into and discuss. Now we have lived longer with HIV. We are independent. We are doing whatever we want to do. Actually, we are living a normal life. And then the question is, how much have we invested in the younger communities that are still coming up? How much have we put into some upcoming organizations? Because as far as I can see, we have managed to get great champions by empowering them to be living with HIV and impacting services that affect people living with HIV. I'm talking about clinical services, taking part in research work and all that. But it doesn't mean that HIV ended up with this generation that we are. We are getting older now. Things have changed. And what impact have we done to the younger people that are still coming up? Because there is actually new infections everywhere right now. And what is going to be happening? I feel sorry. There's been so much cuts in everywhere. Financial cuts in the economy, and this has affected our service delivery to younger generations. Then I'm thinking, okay, Maureen, now you are going to be in my 60s. Very soon I won't be this vocal, right? And then what have I done? What impact have I, what legacy am I going to leave for the younger people that are upcoming? Because the HIV is still spreading. HIV is still there. And I'm talking about what is the tomorrow gonna be for younger people and the other organizations? Because I'm looking at all of you right now, talking about 20 years time, we won't be there. But what have we done to push this level of HIV and stamping down stigma and discrimination? Because I'm looking at it like, now we still got this stigma going on. There is high levels of stigma. I can't talk about my HIV diagnosis in church. I can't talk about my HIV diagnosis with my friends. Why? Because we still have got stigma going on in the communities. It's something that we need to address. How are we going to address it? We have to engage with who? Where am I found? I'm found in the church. I'm found in any religious practices. I'm found with my social networks, and those places, in the pubs, in the saloons. I can't speak about my HIV diagnosis right now. So how can we move into there, getting into where we meet BME communities, where we can freely discuss with them? Because now, even if I'm going on the underground, when they're talking about HIV, it's all about pictures of white or gay men or, bisexual and all that. But BME communities, we don't talk about our own BME, Black people who are gay as well. We don't talk about that. We don't address HIV in our BME communities. Even on billboards, World AIDS Day has died down. If you really look at it, World AIDS Day is nothing of that importance now. And HIV, we're talking about HIV in smaller quantities, yet there is high risk. Of course, there is COVID, but HIV is still there. How are we going to make that change? So I'm saying to myself, Maureen, now we are the generation that has to push for a change to come to zero in London within the BME communities. And it's my responsibility. Now I wear off my cap. I put it on now as the community engagement lead to push this, because I have to leave a legacy. I have to protect everybody else coming after me with my story. But I can't just open up and say, whilst I'm still inferior about talking about HIV, and where do I talk about it? I can't talk about it on the bus. How are we going to normalize HIV the way we are normalizing COVID? We know there's so much stigma on COVID, but still the stigma on COVID is even better than the stigma on HIV. But yet we've gone miles and miles in moving with this agenda. So I think that's where we are. And
Okay.
when we work on that, we will get to zero sometime, but it's not going to be today. But I'm so confident that when we bring out a lot of Maureen's out there who can speak openly about themselves and share their experiences, and we get the support that we need. And many of Jide's, now we can't even, Jide is the only one who, I'm sorry to pick on you, Jide, is the only one who's strong enough to say talk to the, the clergy about being HIV. They can't talk about it, but they are there in the African communities. So we need to push that on the agenda. Thank you so much, Jane, and the whole
No,
panel.
well, thank you, Maureen. That's a very powerful opening and starting us off with a real great deal there to think about. I'm actually going to go to Vanessa and ask her if she might comment, because there is certainly something that sticks in my mind, a quote from Bakita KK, who said, if you put your services within our reach, we will use them. So Vanessa, having heard what Maureen's got to say, as a service provider, some reflections.
No, well, firstly just to say thank you to Maureen for being so honest and raw and just getting that message out there. And I think that exactly what you said, Maureen, is it just highlights the power of the lived experience and how, as services, we cannot lose that. We cannot stop talking to those that are using our services, and we cannot stop learning from you to work out what we need to do next. And I think that for services to keep on developing and having that legacy, I think it's really important that we really think about the social context in which people are living and what is happening in their lives. What you've just said about the stigma that you're having to face day to day, if we don't discuss it, if we don't name it, when we're trying to develop services, it won't be right for you. So I think for us as service providers, it's about constant reflection about what we're doing. It's about recognizing that what our role is, how can we support, identify people's needs and priorities, and really think about personalized care. So not have a blanket approach, really think what is important to that individual. And the other thing just to highlight is that, what we're doing here is we're talking about Black people, and you cannot get away from the fact that when you're talking about Black people, you've got to own what it is like to live as a Black person within the UK. And we do experience racism and the effects of racism and how that affects our day-to-day lives, how it affects our opportunities. And then you add a layer of HIV, it's a completely different dimension. And I think that as service providers, we really have to name it, own it, and respond to it. So that's what I would say in terms of services.
Thank you very much, Vanessa. And that's a really powerful message about paying attention and personalizing. But actually, I want to just come over to Jide now, because I think Maureen spoke very powerfully about the church, about faith. And actually, I don't know whether you would consider yourself to be a service provider in that way, but I know how much people depend on their pastors, their faith and their church. So Jide, your reflections.
Well, thank you so much, Aunt Jane. And of course, thank you to Maureen. I'm also keeping my eyes on the comments in the chat as well. And something just caught my eyes. I think that, faith leaders can do better. Faith leaders can support their communities and the people that use their communities. And with that said, faith leaders need to also have the full information about HIV, as they will with any other things. If a member of your congregation go to you for financial advice, as a minister, if you do not have the financial skill, you send them to a financial advisor. If they come to you on matters of the law, you're not a lawyer, you will send them to a lawyer, and so on and so forth. It is the same as well, but at least the ministers need to have the basic knowledge or information around many social issues. Maureen has spoken quite well about, the fact that she and many of us, even myself living with HIV, feel very invisible within the church. The church is not a service provider, but the church can support service provision that are in the society. I think that lived experiences are important. Not too long ago, a book was published called Who Cares About HIV? And that book particularly chronicled, how Christians and other people of faith has been stigmatized, shamed, and discriminated against when they approach their religious leaders to tell them that they had an HIV diagnosis. So we can do a lot more. Now, we do not need faith leaders who are not community leaders. They have to lead by example. We do not need qualified theologians who are ignorant of their congregational sexual health. We do not need faith leaders who bury their head in the sand on this matter, particularly on sex and sexuality. I believe that the church needs to talk more about sex and sexuality so that we can get down to zero as quickly as possible. I mean, for me, the way that I've worked with sexual health in my church or in my congregational setting, when I go to events like this, I will come back and tell them what I've been doing in the week. I get to tell them about what is PrEP and what is HIV and so on and so forth. But we must talk about HIV specifically. And I think that, Maureen also mentioned on the fact that it seems that we're not represented across our communities and society, or when she goes on the tube, she doesn't see anything. Well, I don't think that the information is largely just for gay men. And many of us know about PrEPstar. PrEPstar has done so much work in promoting sexual health awareness. They have done a lot of work. They've just released a new film that's about date PrEP. Many of us should watch the film and share it. They also did a project with Bridgestone Bristol and Yorkshire Mesmec, where they were promoting PrEP and also HIV prevention tools. There's also particularly another one called PrEPstar for Women that focus on providing information for women. We need to roll this out. And one of the other interventions by PrEPstar that I really like so much is during the lockdown called Sex and Coronavirus. This was particularly targeting men who have sex with men and indeed other communities. But of course, I don't want to just name people. There are people like the Reverend Charles Kwaku Odo in Manchester, who's doing amazing work, promoting sexual health within the church. So let's not forget that. But I think that the other key thing is knowledge. Faith leaders need to have the knowledge. But I don't believe that a lot of the, faith and HIV or faith and religion work is working. I think that we cannot target the general overseers of the church. And I mean the big people. We can't target them. We need to target some of the ministers in the church who are providing the service. For many of the issues around HIV, there's also the issue of homophobia. There's issue of, you can't have sex before marriage, or you can't have sex if you're not married and so on. I think that we need to look at all of those ones as part of the problem. But I think that the key thing I'm going to say, and as I begin to wrap up, is that knowledge is power. We need to put that knowledge back into the hands of the religious leaders. We need to put it in the hands of the communities themselves. We need to put it in the hands of people who are living with HIV. Now, I am a person living with HIV for the past 18 years. I only came out publicly with my HIV status only about 2 years ago. So it took a long time for me, to be able to speak quite boldly about my sexuality and my HIV status, of course. But I think that we need to be working towards a theology of inclusion, a theology that does not discriminate against people living with HIV. And finally, faith leaders can support the listening. They need to listen, they need to support and get involved with the process. They need to perhaps test themselves for HIV to give confidence to their congregation, and also maybe in their congregation have somebody who will be the go-to person on health matters, and that will include HIV as well. Thank you.
Well, thank you, Jide, and that's very powerful views there. One thing I just wonder if I could actually ask you and Vanessa to just think about, because Vanessa, you've spoken very articulately about how important it is to make sure that we have service users and lived experience. I don't know if you could comment on whether there are ways that we could make sure that the clinical and the faith services also overlap in perhaps a different way or useful way.
No, definitely, Jane, because exactly, as Reverend Jenny was speaking, I was thinking, gosh, I can think of times previously when we worked to align ourselves with faith groups, to think about how the language, opening up the conversation, and making people feel confident to be open about their faith and how the importance of their faith, and also supporting faith leaders as well in terms of education and that conversation. And I think that there definitely more needs to be done. And when I think within the clinical setting, I'm very comfortable of how I've grown up and what I've experienced to talk about faith, to talk about anxieties related to it and positives and negatives, but many of my colleagues aren't. And what I'm thinking is really, how do we support our colleagues to have those conversations and for it to be authentic? Because I think some people think, oh gosh, I don't know what are the right words, how, what should I say? And I think there needs to be more work to support colleagues within the healthcare profession to have those conversations. So definitely. So I'll probably get in touch with you today after.
Yeah. No, thank you very much, Vanessa.
Thank you. I also feel that we need to support religious leaders as well. And I think that religious leaders that often go on about HIV is a sin. It's actually not a sin. It's not a crime to be HIV positive. What is actually the crime is the ignorance that comes with it. But I also believe that, the high standard of health is a human right, and we need to focus on that. People living with HIV deserve better, and we deserve better, particularly from our religious communities and our religious leaders. And the more we can provide them with that information and a platform, to understand the needs of people living with HIV and indeed other long-term illnesses, the better the religious communities will be themselves.
Thank you, Derek. I can see you've got your hand up. Do you want to chip in here?
Yeah, just a couple of seconds. I mean, we are in Black History Month, albeit coming to the end of it, and just brilliant contributions, by the way, that I've just heard. But because I thought I would today look back over some of the great reservoir of information that has been generated by AHPN. As you all know, AHPN has been on a long journey these last 20 years, and there have been peaks and troughs. And during some of the peaks, going back 10 years, 8 years, there was some fantastic work done with faith leaders in the Christian world, in the Muslim world, faith toolkits generated. And I was looking back over some of that work today, and we need to do two things. I think, A, recognise the shoulders upon which we stand to have come to this point, which is the point Maureen was making about having some kind of a legacy, which is great, I think, a great point. But also, let's not reinvent the wheel. I would really be happy when we find the time, Jide and Vanessa, to sit down and share some of the information that has been generated. The situation hasn't really changed. The issues we're speaking about now are the same issues we were speaking about, albeit I wasn't here, but the same issues that were being raised, 8-10 years ago. And we can share some of the work that AHPN have done, and that might give us some more shoulder pads to stand on.
Yeah, no, thank you, Derek. And I think those are very the huge amount of work that we've got under our belt to utilise.
Jane,
Yes?
just jump in very quickly. Hi, Jane. It's just Palia. Sorry, somebody is actually sharing their screen. If they could everybody could just double check their settings. They've taken over control and they are sharing their screen rather than us having view of the discussion. So I'm requesting control back off you. If you could stop presenting, that would be great. Perfect. Thank you.
Are we back online? Are we back in the right place?
Please continue.
Fantastic.
Thank you.
Okay, so actually I was going to turn now to Robbie because Jide's talked very powerfully about prevention, about PrEP, about a variety of other modalities here. And I just wonder for you whether you'd help us reflect a little bit on the better engagement with HIV prevention services as a commissioner in a very diverse area of London, whether you've got thoughts that you could share with us about prevention.
Yes, yeah, no, absolutely. Thank you very much, Jane, and thank you to all my previous panelists for sharing what we've done and what we need to kind of continue to do. I suppose I've just got a couple of reflections before tackling that. One, I think the thing about it that certainly that I know is that we very often just sort of talk about BAME kind of communities or BME kind of communities. And sometimes that's actually loses the richness and the diversity that actually of the people that we're necessarily talking about. And certainly at a public health kind of level, we can very often just sort of lump disparate kind of groups together just because it's easier and kind of convenient. And I was very struck by Maureen's kind of lived experience and the individual experiences of that. And obviously we can draw themes from individual kind of experience, but we also know that even just talking about, as you mentioned, Maureen, what's our legacy going forward for young people, that young people are incredibly diverse. They may be second or third generation migrants, and equally people that have potentially lived here, and they bring a huge, rich tapestry to everything that we are doing. That in itself can make things actually quite complicated. And certainly one of my very first thoughts of when I was asked to participate here was engagement with HIV prevention services. And that in itself, to me, certainly now in light of the COVID kind of pandemic, is that many services are all and need to be involved in prevention. And that is not just traditional clinical services, but that is also community services, GP practices. Jide, you sort of spoke about supporting and that faith groups can support the prevention kind of agenda. So certainly it feels to me that one of the things that we tend to miss a little bit is that we tend to sort of put things into little boxes, or that this service needs to be kind of commissioned in this particular kind of way. And I myself, certainly as a commissioner, I know there are other commissioners have joined the webinar today, so I can only really sort of like talk from my own kind of experience within that. But also I know that that there are huge programs and diversity of programs that are kind of going on to actually be able to make sure that prevention becomes actually much more clearly all of our business and all of our work that we want to do that, whether that be through the Making Every Contact Count kind of program, whether that be through the innovation of bringing HIV tests into the health check program that is going on, whether that actually be through the Fast Track Cities initiative of organisations applying to some of those funds around the Improvement Fund, or actually the PHE Innovation Fund to be able to push those things, or actually through working through faith groups and everything as well. So I mean, very, very clearly, we have a very rich. I know that things are very strained at the moment, not just because of the circumstances, but also financially. As a commissioner, I can attest to, Maureen, you were saying cuts. I can attest to some of the challenges that's absolutely presented. But that said, there have been a whole range of community groups. Obviously, I want to name check I Want PrEP Now and Prepster, because they have been absolutely instrumental in raising the opportunities that PrEP affords other kind of populations for the benefits of anti-HIV medication used for preventative services. Many of you will know we've had some tremendous difficulties of being able to get that routinely commissioned, not just across London, but across the country. I'm really pleased that that has actually now gone forward, and that many services actually across London now are offering that. But actually getting people to access those services is still a big hurdle, particularly for our black kind of populations. That said, we can all pull those bits together. I'm always struck as a local commissioner that many of my populations maybe do not access services in my area, and equally may travel to other parts of London to be able to access services and or social events and or their community kind of assets. what's crucial to me is that we absolutely need to be able to pull some of those kind of things together at a much larger kind of geographical footprint. Certainly with the restructure of looking at the CCGs have come back to a sub-regional kind of level. Certainly in my CCG sub-regional area, we're trying to pull that together so that we can look at our resources and collaborate more over that to look at a larger kind of impact that we can necessarily have. But as I say, I think that we're missing a trick completely if we do not recognize that, just as you said with your lived experiences, Maureen, I think you described it eloquently. You said that you're in church, you're at this service, you're at this place, you're at this place and at this place. All of those places have a role to play in HIV prevention and reducing stigma. We've still got a lot of work to do, but I do think that it's important that we absolutely celebrate our success. And Maureen, my final point, I think something that we just need to remember is that after 30 years of campaigning to get adequate sexual and reproductive health education into our schools, which will greatly benefit the next generation, because HIV is on the curriculum and will be addressed. This is a great opportunity for us to be able to engage a whole range of community assets to look at that. Sometimes we have great attraction with saying that this is something that we wish to do with younger people because we need to create a legacy going forward. So there are many, many levers that are available to us. And I just hope that we have the opportunity in all the noise that is COVID to be able to seize those opportunities and take us forward. Thank you.
Well, thank you, Robbie. And actually, as you were speaking, that was one of the things I was just going to try and reflect back and ask you. Given the absolute overwhelming nature of the COVID response, in very difficult financial circumstances we're in, how do we make sure that we keep HIV on the agenda, particularly on the agenda of commissioners who are, you're being stretched every which way in terms of finance, and whether you've got any tips for how we might, in today's world, make sure that we're not overlooked and these needs are met.
Sure, thanks, Jane. I think excuse me. I think the thing about it is that we need to recognise the power of local politics. Local politics is incredibly important. So for all kind of community groups, faith groups, other groups, it's like going, if you do not have your local ward councillor on your board of trustees, I would raise the question of why. We need that voice locally and politically to be able to gather some kind of traction. So I think the thing about it that I want to say is that there are many, many different routes and levers. We all play different parts. We can't necessarily find this one person that's able to unlock a key. There are many players, and I think at the moment, to make sure that the local voice and everything is heard is to absolutely engage with your local kind of politicians at the moment. Believe me, as a local commissioner, if I get anything that comes through from a councillor, it has a different resonance than if it comes from another area, let's just say. But I do think it's absolutely important that you work with your local kind of commissioner. You know a lot more of your communities than necessarily that I would. It's crucial that you help us understand those needs, but it's also crucial that you work with us to find those solutions. And some of those solutions are not just more money.
No, indeed. And thank you very much for that. And that actually probably takes us quite neatly to Derek, because it isn't always just about more money, and it isn't always just about health either. It's about a whole raft of other things. And, we've been hearing a little bit about sort of human rights and social justice. And also there are really at the moment very complex issues about migration, asylum. And where do we start with these really big human rights issues and take some of that conversation forward? So I'd be really interested in your reflections, Derek.
Thank you, Jane. As you say, where do we start? These are massive issues: HIV, social justice, human rights, internationally massive, and locally, of course. The criminalisation of HIV, the impacts and the effects of this, punitive laws, criminalisation of sex workers and people who inject drugs, the whole stigma and discrimination discussion, which Maureen eloquently spoke about just now, gender inequality, lack of access to services, which Robbie has just spoken on. But I think Vanessa really, for me, hit on something when she talked about the layers and the intersections of all of these issues and race, because the impact of all of those headlines that I just mentioned are very different for people of colour migrating to these shores. And I think that obviously characterises their experience. For me, the R level that we hear about so much with COVID, for me, that is race and racism. That pervades everything. And I think we have to look at social justice and human rights and HIV very much in that intersection, through that intersectional lens. But how do we work together to improve social justice and care for migrants living with HIV is the question. And I think the answer, or part of the answer, is implicit in the question, that working together bit. And you spoke in your introduction about fast-track cities and networking, and that is part of the key. It doesn't get us to zero, but it means we're on the fast track, maybe on the right track. So organisations like networks like One Voice Network, organisations like AAF and House of Rainbow, we need to be working with the JCWI, the Joint Council for the Welfare of Immigrants, and the Refugee Council, as we do, and mental health organisations and organisations involved in relieving poverty and the various destitution services that we have locally. We have to be linking with all of these, because HIV does not exist within some kind of isolation or some kind of vacuum. And so, as we say, organisations such as ours and yours out there in the audience, we should be working alongside those organisations that focus on those issues that we've just mentioned, and we should be adding value to those human rights organisations. But let's not lose sight of the bigger picture. These issues are way too big to discuss in 5 or 10 minutes, obviously, but let's not lose sight of the bigger picture. Yesterday we heard of the tragic loss of life in the English Channel, and that is all prescient in our minds, obviously. A few years ago, remember, just cast our minds back, a few years ago, the UKIP party was alongside their Breaking Point poster, which we all know about. They were at the same time saying that, migrants living with HIV were costing the NHS too much and trying to make political capital out of that. Now, they were heavily criticised and censored for that, but they made the statement nonetheless. Currently, we're seeing the NHS under great strain. And given what we know about pandemics from all our previous work, we know there are 4 stages to pandemic. We know we've just been through it, so we can all call it to mind. There's the initial denial, then there's the begrudging acceptance, then there's the crisis response, which is where we all are now, and then comes the double whammy. The 4th one is always recrimination. And I think these views are bubbling just under the surface. So I think we have to be aware of this, be very proactive, work together, but also be politically astute in the way we position ourselves and learn where our allies are, so that we are prepared for the 4th stage of pandemic when it hits, because it will surely hit.
Well, thank you. No, thank you very much, Derek. And you're right. These are not things that can be solved in a few minutes discussion. But I think one of the things that I'm thinking about as we're talking is the Fast Track Cities is a global initiative. And we've got cities across the world, and London as a global city. At the moment, we're focusing very much on the health and care sector and the faith sector, but actually we have the resources not only in our city but in other cities to perhaps bring in the talent and the power we need. No,
we can hear you, Jane.
We can hear you.
We can hear you.
I've unclicked myself, but I'm just interested to know what other parts of our city we should now really be moving to bring in some of this additional resource to tackle some of these bigger problems. And I don't know where we take some of those conversations outside the health and care sector, if you like. And maybe Derek, you're already you and Jide are in a conversation, in a bigger conversation that maybe can help us.
Yeah, I mean, I was actually going to comment as well. Thanks, Jane, and thanks, Derek. And I think that, one of the things is that, there are religious organizations outside of the UK that are actually doing very well when it comes to issues of HIV and sexuality within the religious communities. And I'm actually part of the INRELA network, the international network of religious leaders living with HIV. So, and I also happen to be the chair for the European chapter. So you'll be hearing a lot more from us. Now, having said that, I think that it is actually quite commendable to actually talk about creating a task force within the religious communities so that they too can take ownership, because it's as if that we're trying to get them to come to us, as the provider. Perhaps we can go to them and have that conversation about, why don't you start a task force within the religious communities, and we can provide you with the tools and resources. And of course, Robbie, there is going to be local politics. There's going to be local politics around the issues of culture, what the religious book says, and so on and so forth. All of those things are there. But I don't think we should reinvent the wheel. There are resources, I did go a little bit into Prepster earlier on, but there are also other organizations across the UK, that provide services that we need to illuminate what they're doing. We need to highlight it. There is another organization called Black Beetle Health, and there is LGBT Foundation, there's Terence Higgins Trust, and I think that, we need to bring all of these resources together and begin to use them as a teaching tool. The religious leaders do not have the monopoly to the health of the people, nor do they have the monopoly, to the presence of God. But I'm just saying this for saying sake, because it is important to make sure that this is highlighted. People living with HIV are in our pews, they're in our churches and in our mosques, and they need our attention now, not when things go crazy.
Well, thank you very much for that, Jide. One thing that I was going to just bring in, and just thinking about sort of linking some of these things up, is that we know that Black people tend to be diagnosed often later than other communities in this country, which means that some of the benefits of earlier treatment, some of those other things are not fully fulfilled. And one area where we do know that people often use are their general practitioners, primary care, and there's quite a lot in the chat here about barbers shops, other services. But Vanessa, I just wonder, and Maureen, actually, we're talking here, we haven't really mentioned GPs, the other sort of medical front doors, if you like, where some of these things, again, are very place-based, and often GPs and churches may be quite linked. But I don't know whether you could comment briefly on how we might think more broadly about the health sector, particularly with primary care.
Maureen, do you want to go, or shall I?
Yeah,
I can see you. I can see you.
I know. I mean, it really worries me a lot, especially when you start talking about GPs. And I have got this vision where whenever I visit my GP practices here in my area, and the majority, I would say, I'm not stigmatizing or everything, but from my own perspective, looking at the majority of people who attend GP services and, all those other services, the majority of them, they are the Muslim communities. But when I look at this forum right now, where we are, all of us, they are not represented. And just not today. Everywhere else, wherever I go for any other meetings like this, the Muslim communities are a bit not engaging. I don't know if I can use that word. They are a bit sidelined, and it's something that we need to address as BME communities. We really need to look into that. We should be having an imam on this platform. We should be having a Muslim community representative in this platform. So it's something that we need to look into right now if we really want to move forward. And then when it comes to service provision, let's have our communities engaging with everybody else, the services that are around, those that can speak out like Maureen. We need to be pushing for that, being involved into patient forums wherever. I mean, within the GP practices, you know, the dental practices, the gum clinics. If I really want to be honest with you, gum clinics are less represented of BME communities. I don't know, is it the fear of being there, or I don't know, it will really be the ignorancy of it all, or there is some stigma attached to visiting those places, which is something that as a forum today, we need to look into some of those things and try to iron them out so that we can come to our main goal, which is cutting down to zero in BME community infections.
Yeah.
Thank you, Maureen. So Vanessa, coming back, GPs, gum clinics, and then I'd like Jide to reflect on imams and how we can do interfaith relationships.
No, definitely. I think we definitely need to look at the wider health piece and how people are engaged in that and actually feel safe in those spaces and actually are able to even know what those spaces offer. And I think one of the things with GPs, so we've been doing some work in East London just trying to reflect about this, particularly in this COVID era, about how we work better with GPs in communicating. And still the narrative that I get from a lot of people that I'm working with is about that anxiety about going to the GP, going to the receptionist, facing that layer of stigma and thinking, actually, I just don't think it's worth it. I don't want to put myself there. So I think it is really about going back to basics with at each health space to say, really look at stigma and discrimination and really keep that education going. And to be honest, I don't have the answers for it but I think what we need to do is keep being proactive in looking and exploring about it, definitely.
There's a lot here in the chat actually, which I hope we can pick up on, and we'll keep and see. There's some good suggestions here too. But Jide, the point about interfaith, more than, you know, how do we make this work?
Well, I think I'll go back to the same point that I made just a moment ago, that, you know, we need to look at a task force for the religious communities. And if that be interfaith or during ecumenical, relationship, then that will work out well. And I think that the reality is actually to talk to the heart of the matter. And I'm just so glad that you mentioned issues around late diagnosis. I mean, I had it on my notes, but I haven't actually quite got to it. Now, of course, I'm also a volunteer chaplain at Migrants Mission Hospital, which is obviously known for its HIV treatment and focus. And, you know, as a chaplain at the hospital, I have seen a high percentage of Black and people, not just ethnic minority, but Black people coming with late diagnosis for treatment. But I think that, you know, this is also the area that we need to be looking at. I can tell everybody right now, I'm not the typical everyday priest. I am a Black man of African descent. I am gay, open with my sexuality, and I'm living HIV proudly so. But I think to have this conversation with other ministers, be it Christians or Muslims, it's going to take a lot more guts for us to do that. But I can tell you this honestly, there are ministers, even including imams and Christian leaders who will want to have this conversation. We need to get them around the table, and Maureen has made a good point. We should try and get them onto a panel discussion. I think that Positive is just launched a new booklet about HIV and Islam. I think that's also an area that we can tap into and begin to bring all this information out one at a time. Let me say something quickly. This is going to be quite short. Vanessa, honestly speaking, Vanessa, I think a lot more, and also to Jane, a lot more work needs to be done within the NHS. Medical staff, doctors and nurses stigmatize people living with HIV. This is not right, honestly speaking. That is why a lot of people can't go to their doctors. A lot of the GP do not have, you know, a basic knowledge of HIV, and that is heartbreaking in this day and age. They need to go back and do a refresher course. You know, I think that they signed up, you know, to take care of our health, not stigmatize us in the process of it. That's why many people don't go to the GP to talk about the HIV. They rather stay with the consultant.
Yeah.
No, well, thank you. That's yeah. We thought there's a huge issue of how to manage that. But Vanessa, I can hear you trying to come back in.
No. I just completely agree, and I think that, you know, even as us as healthcare professionals, when we see colleagues in other spaces and the way that they will behave, you flinch and think, no, this has to change. And I all I can say is that we need to be committed to achieving that change, and the education just can't stop with one kind of refresher course every year. It needs to be more intensive, and there also needs to be more accountability from trusts as well, and also primary care, including GPs, pharmacists, etc. Completely agree.
So now look, we're out of time, and I know we started a bit late, but what and then we could go on because there's lots happening in the chat and lots here, which is really rich and really important. But what I'd just very quickly like to do is just, if you would bear with us to carry on for another minute or two, just to go around each panelist for one closing sentence on where do we go from here, because actually we're talking about some really big issues. We all want to see this move forward. We all want change. What's the one thing that we're going to take away from here and we're going to do as we go out? So shall we go round? Vanessa, do you want to start? Is there one thing that you take from this?
It sounds really cliche, but we go together. I think that what's been highlighted here is the power of the conversation. And if I didn't hear what Jide was saying, I didn't hear what Maureen was saying, I wouldn't know what the next step is. And already these conversations have brought up many next steps. So I think that's what I would say.
Thank you. Derek, you got anything you'd like to say as a...
Let's get off unmute. Yes, thank you. Excellent. Yes. I would say, I mean, there are so many things, obviously, but funding, resources, for me, that's the key. And we have to recognize that when it comes to funding and resources, we have to realize our own power as a community, as a sector, and the leverage that we've got. And we've really got to get business-like about it in the discussions that we have with the major funders. You know, look at the politics again, not talking about politics, but where people are on the back foot, you can use your leverage. You can have discussions that maybe we couldn't have had a year ago. We can have those discussions this year because of the political landscape. So I really think it's about, you know, trying to get real about it. We need to be a bit hard-nosed, even though we're in a sector where we care and we know each other. We have to have a business mind when.
Thank you. Robbie.
Hi, yeah, thank you. I think one of the things that we need to recognise is obviously this in itself is a fantastic forum. So I want people to absolutely engage with Fast Track Cities. It's a massive resource, as you mentioned, Jane. It's global. There are global cities that we can necessarily learn from. And I know that with some of the engagement activities that I was involved in with the Fast Track Cities, that there was a project looking at how we can reduce kind of stigma. And I know that in South East London, we're looking at how we can actually try to make one of our trusts stigma-free. So one of the things about it, and I absolutely see, I think Maureen, you raised that particular point, is if we actually look at the stats, unfortunately, NHS services do consistently come out as being places of stigma. Obviously, not our sexual and reproductive health services all the time, but other touch points. And I think it's absolutely crucial that we start to take that out of sexual and reproductive health and HIV and take that out into the wider community that is our NHS. So whether that be a local trust or whether that be your GP practice, I think that it's absolutely crucial that we use that leverage so that people, when they go into those services, absolutely have the best experience that they can. I think it's important that we look at our NHS, get our NHS house in order to demonstrate incredibly good practice.
Great, thank you, Robbie. Jide, last thought from you.
Thank you so much. I mean, I was just thinking about as everyone was giving their last thought. I think what I'll say first is that people living with HIV have lived experiences, and that lived experiences is now a professional experience. So please don't take it for granted. You know, they need to be paid what they're worth if we want the information. And I think that the other thing again is that I'll go back to the fact that we need that task force, you know, in various communities, and religious leaders need to be community leaders. They need to know what is HIV, you know, for everything that is worth. These are life-saving skills that can save members of the congregation and members of their community. And finally, knowledge is power. This platform, this forum is about knowledge and power. Knowledge is power. If we have a religious leader that can come here, you know, after a few months or years of working with us and give a testimony about how they have learned, that would be incredible.
Thank you. That's great. Now, Maureen, you dropped off. I think you're back.
Yeah, I'm back.
As the person who spoke first, I give you the last word.
Yeah, thank you so much. I mean, like I've said before, there's been so much resources that have there's been installed in us, and we are where we are today because of everybody. Vanessa, Robbie, I mean, you've been so effective in our lives, and we are so grateful. I won't even talk about Jane Anderson. You've done so much great work. G-Day, you've just pulled us through to be where we are today. So please use us. Use us to make that difference. Let us talk to them that need us. And you, Robbie, use us, please. Like what Jide said, there is power in this, in a testimony, and especially a living testimony. We've lived the experience, and we know how it feels to swallow those tablets every day for the past 15 years and never miss, not even a dose. So I have got a story. So my story needs to be heard, but it could not be heard if you don't give me the platform. So use us. We are here, and then we impact the generation to come. We want to leave a legacy. Thank you.
Well, a very powerful end to a really, really interesting and very exciting panel discussion. Thank you all very, very much. I think what I'm hearing from that last bit is what you were saying, Vanessa, go together, that we actually have power together, we have skills together, and joining up coalitions, networks, using all the power, all the expertise, bringing this together so that we can make the impact that we need to make to get to zero. So I'd really like to thank all our panelists, Vanessa Appiah, Maureen Ndwana, Jide Mccauley, Robbie Curry, Derek Brown. Thank you all for giving your time. For the Fast Track Cities Secretariat at Healthy London Partnership, Palia and Maria and Jess for actually making this happen. Thank you all so much for doing that. And the One Voice Network for agreeing to partner with us today in what has been a really exciting and powerful meeting. So this is just the beginning. This is, we can go forward from here and we can make that difference. So thank you all very, very much. And I'm sorry we haven't had time to get to all the points, but we will keep all this chat. We will look through it all and try and make sure that we act on the things that need acting on. Derek, I don't know if you want to say anything at the end from One Voice Network, but thank you from Fast Track Cities.
Just to say it's been a pleasure being part of this partnership and networking. And yes, there's a lot of rich information. And I just think keep the positivity there and keep the direction and keep the direction of travel going forward, and we'll be okay. It's a question of working together and working smartly together, and I think we're on the right road. Well done.
Well, thank you all very much, participants. Thank you for all the people that joined, and we'll hopefully have another webinar before too long. So thank you all very much for coming.
Thank you.
Thank you.
Parley, are you still there? You haven't vanished, have you? Parley, have we still got you?
Yes, I'm just back.
Jess, have we got? And I can see Vanessa's still with us. That's good. Anything we need to debrief on? MM.
I think it was great. I loved it. Thank you so much.
Oh.
We get it. You're tricking us.
Oh, goodness me. And I'm sorry, my mute button is right next to this screen thingamy, Bob. I think I've clicked. I think my mouse went across. Something weird. I'm so sorry, whatever happened in the middle of that.
You didn't mute, Jane. I'm not sure. Someone
No, you didn't. It wasn't a mute, but I think you might have shared your screen. That was the only thing that I noticed, because I couldn't tell who it was, but somebody had started presenting on top of the presentation. So,
Yeah.
but it's your screen, so you could still see everybody talking, but it was just an odd way of looking through it. So,
no,
I think.
Sorry, Jane, I missed my segue.
No, I think it worked all right, because we
Yeah,
managed,
no,
I think, to
it was
get
great.
the
Brought it round.
connections, and I hope we, again, I'm always worried with these things that we're talking to ourselves, but actually, I think there was a good looking through the side. There was a lot of people there. There seemed to be a lot of chat going on. Parley, I'm not quite sure what we're going to do with all that, or how we make the most of the richness there.
There was so much there. So yeah, I'll keep that all. I can easily keep that. I mean, I've recorded the session anyway. So yeah, we've got everything that I can stock it away, and we can pull it back out and have a look at it like afterwards.
Yeah, we'll do it all together. So we've got the recording and we'll share that, and then we'll pull all the notes. I can take them all off the chat, can't I, Parlia?
Yeah, I can do it for you. It's fine. I'll send it to you, Marina.
Fab. Yeah.
Hi everyone.
See, Helen's still here. You were great, Helen. You were chatting, and lots of chat. I could see you busily away in the margin.
No, I just wanted to say it was really, really good. But one of the things that came through really strongly for me is this can't be it. It needs to be the start of something. And we've got really good opportunities. I think, some excellent points around who's around the table, who's not. And I certainly, and I know lots of other people, shared this massively up and down the country, because people want to learn, from London and from other places as well. So I just think this needs to be one of many, but I know that obviously you guys did the bulk of organising, so I'm not going to,
Yeah, to be honest, when we started the conversation, obviously Dennis chip in, when we started the conversation with One Voice Now,